Hey guys, welcome to the channel The So Bones, and before starting the topic Radial Nerve, I will request you people to please subscribe the channel. Now starting the topic, the Radial Nerve. Radial nerve is the largest nerve of the brachial plexus and it is a continuation of the posterior cord of brachial plexus. So इसकी root value हो गई C5, C6, C7, C8 and T1. T1 is not constant, उसकी fibers कभी present होते हैं कभी नहीं होते हैं. Then it enters axilla और axilla में ये lie करती है posteriorly to the third part of the axillary artery and anterior to the muscle जो form करती है हमारी posterior wall of axilla को. अब ये एंटर करती है हमारी आर्म में एंटर करती है एट द लोअर बॉर्डर ऑफ द टीरीज मेजर. Then it passes down the arm between the long head of triceps and the medial head of triceps, and along with the profunda brachial artery, it reaches a spiral groove. The nerve in the spiral groove is in direct contact with the humerus, and at the lower border of the spiral groove, it pierces the lateral muscular septum of the arm and enter the anterior compartment of the arm and then descends in the interior compartment. At the level of the lateral epicondyle, it divides into two branches, the deep terminal branch of the radial nerve and the superficial terminal branch of the radial nerve. Deep terminal branch को हम posterior introitious nerve भी कहते हैं, superficial terminal branch को हम superficial radial nerve कहते हैं. अब इसकी branches, एक्जिला में ये तीन ब्रांचेस देती है. फर्स्ट, posterior cutaneous nerve of arm, second, nerve to long head of triceps, and third, nerve to medial head of triceps. Posterior cutaneous nerve of arm provide करती है sensory innervation to the skin on the back of the arm up to the elbow. Spiral groove में ये 5 branches देती है. First, lower lateral cutaneous nerve of the arm, second, posterior cutaneous nerve of the forearm, third, nerve to the anconeus, then nerve to the medial head of triceps and nerve to the lateral head of triceps. Lower lateral cutaneous nerve of the arm provides sensory innervation to the skin on the lateral surface of arm up to the elbow. Posterior cutaneous nerve of the forearm provides sensory innervation to the skin down the middle of the back of forearm up to the wrist. जब ये नर्व एंटीरियर कंपार्टमेंट में एंटर करती है तो वहाँ ये 3 ब्रांचेस देती है. नर्व टू ब्रेकियालिस, nerve to brachioradialis and nerve to extensor carpi radialis longus. डीप टर्मिनल ब्रांच, जिसको हम पोस्टीरियर इंट्रोशियस नर्व भी बोलते हैं, सप्लाई करती है 2 मसल्स को, एक्सटेंसर कार्पाई रेडियालिस ब्रेविस एंड सुपिनेटर. आफ्टर सप्लाइंग दीज 2 मसल्स थ्रू द सब्सटेंस ऑफ सुपिनेटर, इट एंटर्स द पोस्टीरियर कंपार्टमेंट ऑफ फोरआर्म एंड सप्लाई ऑल द एक्सटेंसर मसल ऑफ द फोरआर्म. It also gives an articular branch to the inferior radial ulnar joint and wrist joint. Superficial terminal branch of radial nerve, जिसको हम superficial radial nerve भी कहते हैं, is sensory and after passing 1/3 down the forearm, it passes posteriorly and then emerges from the tendon of the brachioradialis and passes over the tendon of the anatomical snuff box. Superficial branch terminate करती है as cutaneous branch, जो provide करती है sensory innervation to the skin over the lateral part of dorsum of hand and dorsum surfaces of lateral digit proximal to nail beds. So there are 2 clinical correlation of the radial nerve. First, wrist drop. In this, the patient is unable to extend their wrist and it occurs due to the paralysis of the posterior forearm muscle. The second is Saturday night palsy. This happens when there is a direct pressure on the radial nerve when a drunkard falls asleep with one of his arm over the back of the chair. Thank you guys for watching this video. If you like this video, give it a thumbs up. Also share it to your friends and comment in the comment section. Thank you.